looked at over 9,000 trans and non-binary youth who had responded to our survey, and we compared young people who wanted gender-affirming hormone therapy and were able to receive it to young people who wanted hormone therapy but were not able to receive it. And we found significant differences in mental health. So we found that for young people who were able to access gender-affirming hormone therapy, they reported lower rates of recent depression, lower rates of considering suicide or attempting suicide in the past year. From a mental health perspective, it's a very important treatment because it allows people to feel more comfortable in their bodies. It allows people to feel less gender dysphoria or less discomfort. And it allows folks to feel more body satisfaction. In our study, we found that only 14% of young people reported that they wanted gender-affirming hormone therapy and they had received it. So that is a relatively small number. Meanwhile, over 50% told us that they wanted gender-affirming hormone therapy, but they were not able to access. We found that young people living in the American South and young people of color both report higher rates of wanting gender-affirming hormone therapy, but not being able to get it. We would love to see legislators think critically about how can we get more providers trained on gender-affirming hormone therapy? How can we decrease some of the barriers that folks encounter when they are trying to access this healthcare? Due to the culture war and due to our political climate, we are seeing really negative effects on the mental health of trans and non-binary youth here at the Trevor Project. Our research shows that trans and non-binary youth are at much higher risk of considering or attempting suicide in the past year. And we attribute a lot of that to the exhaustion of having your identity and your right to exist and your right to participate in school or in public spaces be debated and attacked every single day. And that's what these anti-trans and non-binary bills do, is they essentially say, you know, we do not think that you have a body that is worthy of medical care. We do not think you are worthy of participating on a sports team. We don't think you are worthy of using a bathroom in public. And yes, that is an incredible psychological toll. And in the case of gender-affirming healthcare, in many ways, the threat to remove that healthcare is an existential threat. I think the way to combat that and the way to push back against that is to also recognize that we are living in a moment of unprecedented trans visibility. We have more folks who have come out publicly and who are living their trans identities more openly as public figures. We have more people coming out in our lives in our communities. And so much of this culture war is pushback against the progress and the success that we've had as a community. And so I would say it is very disheartening to be attacked like this over and over and over again. However, there is hope.